Hi, everyone, and welcome to the Rural Doc Allen podcast. I'm excited to welcome to the program Rural Doc Allen Lindeman. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. Today's topic is placenta clots. Can blood clots in the placenta harm baby?
But yes, of course they can, and it depends on how big the clot is. If it's big enough in the placenta, that can cause a stillbirth or a miscarriage. On the other hand, if it manages to not uh, cause a lot of trouble in the placenta and it still manages to get to the baby, it can still stop the baby's heart, give it a little heart attack, or it can go to the brain and cause a stroke. So it can cause a lot of trouble.
Is it normal to have blood clots while pregnant?
Well, nobody should have blood clots during pregnancy, but the women who are at large or greatest risk for blood clots in pregnancy are women who have had blood clots before they were pregnant.
Do blood clots cause miscarriages?
Yes, they certainly do. Again, if they're big enough in the placenta, that's going to be a problem. If they're a little bit smaller and get to the baby, that's a lot of times that's not lethal, but can be recurrent. There are, of course, mothers who have clotting disorders or they clot too much, and that's not to be confused with hemophilia, which is when the blood doesn't clot at all. There are certain conditions. One of them is MTHFR, and those moms need to have Lovenox in order to continue a pregnancy. But the good news is that they can continue pregnancy and they can stop recurrent pregnancy loss.
When are blood clots most common in pregnancy?
Well, it all depends on if you're having a miscarriage. Blood clots will be, in the first trimester, 6, 7, or 8 weeks. And on the other hand, they can occur at any other time. Certainly, if you have a condition like placenta previa, or if you have an abruption of the placenta, that will cause blood clots too.
And the best place to go is ruraldocallen.com and safepregnancy.com. Thanks, Doc.
Thanks.
Sorry, that was the Rural Doc Allen podcast, guys. Take care.